Hi, today we have with us a young innovator, Pooja Goswami, who is a co-founder of Ramja Genosensa, a medtech startup. She's trying to reshape the future with her innovation. They have developed a paper-based genosensor that detects infection and AMR in 90 minutes. So, Pooja, welcome to Precision Health Talks. My first,
Thanks a lot, ma'am.
my first question to you is, antimicrobial resistance, AMR, what is it? And how does it occur at microbiological level?
So you know antimicrobial resistance. So
Yeah.
if I talk about in a clinical level, it is like when you are if it's sick, you do go to a doctor,
Yeah.
and doctor prescribe you some antibiotics. That is the empirical antibiotics. It means they give you on the basis of their experience
Right.
because test results are not available. Test results will come after 48 to 72 hours. So
Right.
what happens? Doctors do treat patients on the basis of uh, their clinical parameters and their experience. And still, the regular practice is this: whenever you are going to a doctor, they do prescribe antibiotics and they also ask you to give the samples to the lab.
Right.
Maybe blood, maybe urine, depends on your clinical symptoms.
Correct.
So, on the basis of the results, they do change or taper the dose after 3 to 5 days
Right.
because they have to wait for the culture of PCR.
Yeah.
Minimum 1 day to 3 days is the parameter, and after that, generally doctors do change the treatment. So
Correct.
it is actually causing the antimicrobial resistance,
Mhm.
making us sick and immune, immune compromised.
Correct.
But when you are actually in the ICU,
Yeah.
because in the walk-in patients things are still not so deteriorating. But
Yeah.
when you are in ICU, in the ICU, at every 1 hour, delay in the antibiotic treatment
Yeah.
leads to a death rate increases by 10% every hour. तो यानी कि 1 घंटा डिले अगर आपके एंटीबायोटिक हो रहा है तो आपका डेथ रेट जो है 10% आवरली बढ़ रहा है. So doctors forced to prescribe them antibiotics on the basis of their experience and clinical parameters. But it is not the right way to treat because if they will have a direct test within the limit, they can directly give the right antibiotics because the wrong antibiotics leads to the several other infections, and patients do uh, trap into those particular infection cycle. First that respiratory, then sepsis, then SARS, and this whole cascade of event goes started. So here we are presenting a solution rather than going for the wrong treatment on then start waiting for 5 days. You can just wait for 1.5 hour, take the correct antibiotic dosing treatment, and then prescribe. First of all, it will not lead to a patient toward the clinically ill situation
Yeah.
when they will develop the different organ failure. Secondly, the economic burden on the normal patients will be like when this is the routine practice in the ICU, when they start the antibiotics, the dosing of cost of those doses would be started from 20,000
Yeah.
to 5 lakhs. It
Yeah.
depends on the situation and types of antibiotics they are using. Those are very costly. So आपका इकोनॉमिक बर्डन कम होगा.
Right.
सेकेंडरी आपके पेशेंट्स को इतने हाई डोज से एंटीबायोटिक्स नहीं लगेंगे, सो उनका रिकवरी भी फास्ट होगा. और उनको रॉन्ग एंटीबायोटिक्स नहीं लेंगे तो उनके अनदर ऑर्गन फेलियर के चांसेस भी कम होंगे. सो दे ऑल बिकम्स ऑफ द एंटीमाइक्रोबियल रेजिस्टेंस. एंड
So,
आई वुड लाइक टू टेल यू एंटीमाइक्रोबियल रेजिस्टेंस मैं जस्ट यहीं पे खत्म करती हूँ. ये इस समय वर्ल्ड का ग्लोबल थ्रेट है, टॉप 10 ग्लोबल थ्रेट.
बिल्कुल, बिल्कुल, मैं बिल्कुल एग्री करती हूँ because what you are telling me is that if we are able to know about the antimicrobial resistance within a span of 90 minutes, we can always prescribe a precise, medicine,
Yeah.
antibiotic, and we can save so many lives. So, of course, now I would like to ask you that how genomics can help us in the development of rapid diagnostic tools, and what is your technology?
Yeah. So genomics is like the gene based.
Right.
So my technology is actually gene based. It is
Yeah.
not something dependent on the antibody base.
Yeah.
So because we are genetic and gene specific tests are giving, so
Yeah.
it is very sensitive.
Right.
When we are saying the results are actually positive, we have tried and tested and completed the clinical trial in aims
Right.
and random tests. Also, we do test.
Yeah.
They are actually positive because when you have DNA of the bacteria,
Mm.
maybe it is there
Mm.
and now it is being dead, still we can detect it. So you know the chances of infection. जैसे आप एंटीजन एंटीबॉडी टेस्ट करते हैं, उनके क्या होते हैं, as per the half life, the tests do go wrong.
Right.
कि it was the early infection, it was the late infection. But if it is a gene based, the
Yeah.
sensitivity matters a lot, and these are quite precise tests.
Correct. So I think you have covered half of it. I wanted to ask you, what are the benefits of genome-based tests over the conventional method? So can you just tell me about the conventional methods which are used?
Yeah. So conventional method generally throughout the world, what people are using culture and PCR.
Yeah.
So culture is not genome based. Culture is basically is the gene is the bacterial, physiological and morphological characteristics which
Right.
actually dependent on the incubation and the microscopy. So the microbiologists, expert microbiologists do read and suggest. But the limitation of the culture is they can just read the cells between the 10 to power 3 to 10 to power 6 or 7.
Right.
Before that, cells are so less, they cannot read. And more than 10 to power 6, they cannot read. So, half of the patients do remain untreated. So, agar you have 100 patients, out of 100, you will get the results of almost 60 to 30 to 40 patients. Rest remain untreated, and
Right.
even they will be having that infection. And because of the most of the patients antibiotics खुद से लेके आते हैं, तो
Right.
resistance उनके अंदर develop हो जाता है. तो
Right.
culture में तो वो anyways भी patients will not grow the bacteria.
Right.
So this is about the culture.
Right.
PCR is quite sensitive technology. It is gene specific. It
Yeah.
is also fast in compared to in compared to culture. It can give you results within 48 hours, 24 to 48 hours, and it is also gene specific and sensitive as enough as we are.
Right.
And ours is gene specific as PCR.
Right.
And but we are the portable. Portable means for our device, you do not need a huge setup.
Right.
Just a room, 6 by 6 room. You
Yeah.
need only three machines,
Right.
just incubator, centrifuge, and biosafety cabinet. These are the basic machines for the antimicrobiology.
Right.
And you are all set with our one device and one kit.
No.
You are having now a culture lab. अदरवाइज कल्चर लैब को आपको अगर मेंटेन करना है, सस्टेन करना है, आपका 50 लाख के आसपास का खर्चा होता है.
Correct. Correct. So what I get is that you are trying to shape the future in a way that rapid diagnostics and of course to give a precise antibiotic within a time limit. And this is going to save many lives. So my best wishes to you and let's hope for the better future.
Yeah, one thing I just wanted to make you as a comment if you want to
Right.
understand.
Yeah.
This is first of itself a device which is first of all ultra fast, 90 minutes. Secondly, portable. You can take it anywhere around the world.
Yeah.
Third, it is gene specific. So it is comparing all the parameters which is having the information with it. First and most important, it is a so simple a technician can perform. For those techniques, you need expert.
Yeah.
Experts like the microbiologist. But here, our technician can be trained in 5 days and they can perform because everything is automated.
Yeah.
Data will reach on this cloud. So it will be automatically reached, can be studied around the world. So right now, this technology is already Indian patented, US
Yeah.
patented,
Okay.
and we have completed the clinical trial in it. And manufacturing license, CDSU approved, commercially available for anyone who wants to buy.
Okay, okay, that's great. My all best wishes with you. And it was nice talking to you.
Thanks a lot, Manisha. Thank you.
Okay.
Thanks a lot for inviting me and giving the opportunity.
Okay, bye-bye.